Am I my brother's keeper? Today we're discussing healthcare and how our faith guides our decisions. This presentation is just informational, not an endorsement. In November of this year, we are voting on whether to change the way we pay for healthcare in Colorado. Let's start with this. How does our faith address the idea of compassion and how we treat others? The Bible says, "Whatever you do unto the least of these my brothers, you do to me." There is the story of the Good Samaritan, a compassionate man who helped a stranger, and the widow's mite, where Jesus asks us to show compassion for those less fortunate. We are asked to do justice. All of our faith traditions stress healing as a sacred activity. The ministry of Jesus places great significance on healing. The story of Jesus raising a young girl from the dead, healing a blind man and a crippled man. Faith groups have a tradition of involvement in healthcare. Many have created healing centers. These are just some of the many faith-based healing centers: Catholic, Lutheran, Methodist, Presbyterian, Jewish, Episcopal, Adventist, and most denominations include healthcare as part of their statement of principles. Today, many people feel that our healthcare system is broken, that it is too expensive and leaves too many people without appropriate access. Other developed countries have healthcare systems that cover everyone and cost less per person. So a group of concerned people here in Colorado have been working for years on a plan to provide health care for everyone in Colorado. It's called Colorado Care, Amendment 69, and it will be on the November ballot. Colorado Care is like Medicare for everyone. It was developed in Colorado by a group of healthcare experts and reviewed by financial and economic experts in Colorado and nationally. So let's talk about how Colorado Care will work. Every Colorado resident will be covered. You will choose your primary care provider. As a Colorado resident, your health care costs will be paid by Colorado Care. There is a full range of coverage including primary and specialty care, laboratory services, maternity, rehab, emergency and urgent care, preventative care, hospitalization, prescriptions and durable medical equipment, as well as mental health and substance abuse, palliative and end-of-life care, and pediatric services including oral, vision, and hearing. For retired Coloradoans, your Medicare stays in place and Colorado Care is your supplemental. For Medicaid, Colorado Care will be the payer, but there is no change in your cost, eligibility, or benefits. Because the primary purpose of Colorado Care is to improve access to health care for all Coloradans, providers will be well compensated, encouraging our current providers to stay in Colorado and attracting new providers to come to Colorado. It is important to note that Colorado Care is a payment system only. The business model for providers does not change. So how will it be paid for? This is an entirely new way to finance health care. Instead of insurance premiums, cost sharing, and deductibles, Colorado Care will be paid for by a premium tax on payroll and non-payroll income. Employees will pay 3 1/3% of their income, and your employer will contribute 6 2/3% of payroll. Non-payroll income will be taxed at 10% and paid with your Colorado income taxes. Additionally, because this is a state tax, it will be deductible on both state and federal taxes. So the effective rate for non-payroll income will be between 5.6% and 8.5%, depending on your tax bracket. For many Coloradans, this will represent a significant savings from the premiums and deductibles they are now paying. In fact, it is estimated that Colorado Care will reduce the total health care costs for 80% of Coloradans. And for retired Coloradans, both the federal and state tax system allows deductions for retirement income, which further reduces the premium tax for seniors. For employers, Colorado Care will pay for the medical portion of workers' comp, which on average is 59% of the cost of workers' comp insurance. Colorado Care is established as a political subdivision of the state of Colorado, making it exempt from TABOR and not under the control of the legislature or governor. It will be governed by a 21-member board of directors who are elected to 4-year terms. The board is charged with providing quality health care for all Coloradans and will be accountable to the residents of Colorado. With annual audits, open financials, and an appeals process, the operations of Colorado Care will be transparent and fair. Any tax increase for Colorado Care must be approved by a vote of the members of Colorado Care. Members are all Colorado residents who are 18 years or older. Currently in Colorado, residents pay over $31 billion for health care. By eliminating a large part of the administrative costs associated with our current system, negotiating for lower drug prices, and reducing inefficiencies and fraud, Colorado Care will save Coloradans over $4.5 billion each year. That money will stay in Coloradans' pockets, creating jobs and improving our economy. Colorado Care has been endorsed by business people, physicians, and other organizations around the state. As always, how you vote is a private decision. Learn more, consider it carefully, and vote your conscience.